This girl was admitted to the lunatic asylum in 1903 when she was only 3 years old, and today I will tell you her story. Gertrude James was born in 1901 in Leon Mendip. Her mother Ada died when she was only 23 years old, when Gertrude was 3. Her father, who had 2 other children, struggled to deal with her complex medical condition, and she was admitted to the Frome workhouse. The workhouse guardians also felt they could not cope with her needs, and initially she was placed in the Bristol Orthopaedic Hospital and Home for Crippled Children. Dr. Rattray of the Bristol Orthopaedic Hospital and Home for Crippled Children in Clifton reported the following sad case. Gertrude James, age 4 years, congenitally deficient in mind, dumb and unable to stand. Also incurable, has attacks of screaming which disturb the other patients. She is a suitable case for the asylum at Wells. Reason for admittance, idiocy. A playful little child, eyes bluish grey, pupils dilated, palate low and broad. Mentally, is noisy and fretful. Cries and calls mama at times. Take nourishment and sleeps. July 12, 1904. Has not been wet since arrival. A favourite on the ward with other female patients. One patient in particular, Fanny Legg, who imagines she is her child and will amuse herself with her. July 17, 1904. Grinds her teeth constantly. Does not take notice of things and persons as a child of her age ought to. Requires very close attention. August 7, 1904. Appears to have slight convulsions from time to time. Is teething. Requires full-time attention from a nurse or patient in the infantile nursing. Her mind is blank. She is dumb and unable to stand. Lies on a shakedown on the floor to prevent injury from falling. October 12, 1906. Is childish for her years. Cannot articulate but recognise the nurses when they return from leave. June 30th, 1908. She is congenitally defective and unable to articulate, being deaf and dumb. She is helpless and requires close supervision. January 28, 1909. Was discharged from the committee on the 21st and was removed back to the Frome workhouse. Her family were unable to look after her. 2 months later, in March 1909, at the age of 8, Gertrude was returned to the asylum with congenital intellectual insanity. She was 3 foot 6 inches and 3 stone 7 pounds in weight, with a fresh complexion. In March 1909, the asylum did not consider Gertrude a suitable case for asylum care. They recommended discharge to the family home, but the father and stepmother called 2 days before the discharge, saying they could not give the child the care needed within the home, and they could not afford anyone to look after her. So she remained in the asylum. October 5, 1911. Infantile, sucks her fingers or old spools. Has to be fed, unreasonable trouble. January 7, 1912. Visited by her father today. In the afternoon she had a severe convulsion. March 12, 1912. Convulsions continued and she died today at 10:40 p.m. Cause of death, organic brain disease, age 11. She was buried in an unmarked grave at the Mendip Hospital Cemetery. So rest in peace, Gertrude. You will be remembered.